Good afternoon, everyone. My name is George Bray. I'm Mayor of Paducah, and I wanted to just welcome everybody to this opportunity to receive more information about COVID vaccine distribution in our area. It's a very important topic. Everybody wants to know about it. I'm going to just make a couple of remarks, and then I'll turn it over to Judge Craig Clymer. We both, Judge Clymer and I both appreciate the opportunity to convene this group. We all know, we've heard all the national news reports. We know that vaccine distribution nationally is a real challenge, and certainly locally is no different. The state of Kentucky controls our vaccine, the amount of vaccine that we get. They allocate it to us. I know all of us have heard reports of some counties getting more than us, some counties starting their distribution and getting to some of the age groups quicker than we have gotten to them in this city, in this county. Nursing homes, we know that nursing homes have been prioritized, and first responders. We know that both of our hospitals have gotten vaccines and have gone pretty far through the process of vaccinating all of their employers. We know, we've heard that Walgreens CVS is responsible for a lot of the vaccinations. The government has contracted with them, but still there are questions. And I think our citizens here in Paducah and McCracken County deserve to have some of their questions answered. And so that is why the judge and I got together with Kent and started this process. So we're looking forward to hearing some up-to-date information from Kent, but I'll turn it over to you, Judge Clymer, for any remarks that you might have.
All right, thank you, Mayor. And the Mayor pretty well covered what we're trying to do, but our goal really is to give the community reliable information on the current status of the COVID-19 vaccine distribution within our own relatively small community in McCracken County and including the city. We thought it was good to do this because local government is really best suited for the mission. Obviously, safety is our number one priority, safety of the residents. We know best what the local needs are because we are right here with you in the community. We are directly accessible, directly accountable to the citizens, the residents of the county and city. Our concern is that the immediate community within McCracken County has a good focus on what the needs are and what the procedures are. And we want to assure you that you can be confident that we having been put in power by you and accountable to you, have your best interest at heart. So you can be confident we're doing our best to get the vaccines to those in need as rapidly and efficiently as possible and to follow the CDC priorities. It really is a monumental mission. Mayor and I met remotely with Kent, was it yesterday or day before? Time runs together, but we've discussed this thing and agreed it would be a good use of time. We've prepared, we have guidelines, we have procedures, and I don't know the answers, and Kent's much better suited to that, and there may be some questions that he doesn't know the answer to, and there's going to be mistakes made in this process because it being such a huge undertaking and a very novel undertaking, and we'll learn and do better. Of course, the virus is not a stationary target, I think is one of the really challenging parts of it, because our knowledge of the virus's effects and our knowledge of the vaccine's effects, capabilities really evolves. And so I guess I see my role is to try to assure the people that, as we all know, the vast majority of us will not be infected. The vast majority of us will, if we are infected, will recover, but we're all concerned for ourselves and each other's. And, life's about attitude, and let's continue to be vigilant, continue to be responsible. And I think we're making some great progress against the virus. I would encourage everyone to not let up now. Wear the mask, wash the hands, keep your distance, limit your contacts. And when your turn comes, you'll get vaccinated. One concern I do have that's consistent with this, maybe a side point, is that in traveling about, I see in our own community that there are some businesses which make no effort to require customers to wear masks nor distance themselves. And some of the businesses even have employees that do not wear masks. Just to be blunt, that's just both irresponsible and reckless. And it's unfair to other businesses who try to do the right thing. Because if I own a business and I see my competitor allows employees and customers to be unmasked, then I'm tempted to do the same thing. And please consider that it's the wearing of masks and distancing that allows businesses to be open and operating. And we don't want to risk going back to business shutdowns and shut down the economy when we're I think, so close and making such great strides and gains against this enemy that we have. And so that's about all I have to say about it. I think everybody knows or should know Kent Koster. Heads the Purchase Regional Health Department and McCracken County Health Department. Very knowledgeable, very smart on these things. And one thing, I don't know if I've even mentioned it, but I do hope that everybody will, after this discussion, that you will have the confidence that we're doing the very best we can to get this thing done, all the way up the chain, all the way up to the state government, federal government. But we're right here with you. We're doing our very best, and again, perhaps there'll be mistakes made. Hear something that you think is a problem, I'll be glad to take that call. Call me and let me know. I'll try to confirm or confirm that it did not happen, that sort of thing. But we want people to have good, reliable information. So, Kent, what do you have to tell us?
Thank you, Judge. Very happy to be here today, and I know there's a lot of frustrations, and there are some rumors going around that hopefully after we get through with this conference today, with questions that are answered and anything that any of us said, that everybody will have a much better understanding of what the vaccination process is here in Kentucky and what it is here locally. I think, one of the things that we should be very happy about is that we do have vaccines now. We have vaccines from 2 different manufacturers. It's Pfizer and Moderna. And also, never in human history, have we had new vaccines that's been created in less than 12 months, to help bring an end to this global pandemic. But this is really a very incredibly complicated, federal, state, and local public-private undertaking. And there's a lot of uncertainties, there's a lot of frustrations, and missteps, are going to be inevitable. And particularly at the very start, which we're at the start. And, hey, it started right during, Christmas and New Year's. And, communications have been kind of difficult back and forth and up and down the line. So, but the important thing is that we're going to get through this together, and we all need to be patient. So I wanted to share with you a couple of things first before we get started. Just kind of looking at the USA, a high-level perspective. We've got almost 330 million Americans. And as I've already stated, we've got 2 vaccines out there right now. Hopefully in the next few weeks, we'll have, 1 or more available in addition. We have approximately about 250 million Americans that are 18 years and older. And so potentially we have enough for 50 million vaccines for 50 million Americans by March 1st, 21. And the other thing that I wanted to share with you is that in Kentucky, the people over 70 years old represent 11.3% of our population. And those that are 70 years and older who have COVID-19 have 3 to 4 times the risk of hospitalization and nearly 4 times the risk of ICU admission. And about all the deaths that we've had in Kentucky, 75% of the deaths have been for individuals who are 70 years and older. So we know where our most vulnerable population is. The other thing is that we are following the state vaccination plan, and it is in different phases. And we are currently in phase 1A. And phase 1A includes long-term care facilities, residents, and staff. And those are being vaccinated through a national contract with CVS and Walgreens. And then also the assisted living facility residents and staff are included in 1A. And then healthcare personnel in clinical settings, inpatient, outpatient, dental, and home-based. And in phase 1B, it's going to be persons greater than the age of 70 years old and up, and also first responders. There's been a change in the state plan. We've pretty much already done all the first responders. I think the last ones that actually wanted the vaccine that got it was today. And then also in phase 1B is the K through 12 school personnel. So I wanted to give an update on the amount of vaccine that's been received in our area and administered in our area. And I'll start with our hospitals. And first is Lourdes. And they received 975 doses of the Pfizer, and it's 5 doses per vial. And it will have been, they'll have vaccinated around 944 persons by the end of the day. And their focus has been on hospital healthcare employees. And since they had additional doses, because they were able to give an extra dose from each vial, they actually got approximately 6 doses, full doses from each vial instead of 5. And they were actually able to vaccinate our first responders with the Pfizer vaccine. And the first responders initially were going to be utilizing the Moderna vaccine that the health department received, which was only 200 doses. So Lourdes has also received a second shipment of Pfizer vaccine, and they're going to start their second round of doses, their booster doses, on Thursday. And so Lourdes expects to have an additional 100 to 200 doses at the end of giving this second round of vaccine. And they're going to be giving about 125 first vaccines to hospital healthcare workers who didn't get one the first round. And so they're going to have about 75 doses left for community healthcare workers that'll be help coordinated through the health department. And Lourdes has also been on a Tuesday, Wednesday, Friday clinic, for hospital and hospital affiliated employees and first responders. In Baptist, they received 1,200 doses of Moderna vaccine and 600 more this week. Their focus has been on hospital staff and any other healthcare workers in the community. They have given 760 doses to date and anticipate giving 650 more by this weekend. 450 of them will be community healthcare workers. Next week, they plan on vaccinating another approximately 600, and 400 of them will be community healthcare workers as well. So that'll be about a total of 850 community healthcare workers that'll be vaccinated by the end of next week. And then they'll start giving their second round of booster shots. And so they have opened up their clinics and they've made it public, and it's on their website, it's on their Facebook page, that on Thursday, Friday evenings, and all day Saturday, that they are giving vaccines to community healthcare workers. The long-term care facilities, as again, I stated that they are all going to be covered by the national contract through CVS and Walgreens. They've all been assigned one of those pharmacies, and they have all been scheduled. We've checked with them. They've all been scheduled with dates ranging from January 5th through February 9th for their first dose. And to date, only one long-term care facility in McCracken County has received their first dose, and that was River Haven. As far as the health department goes, the health department will have used up their first 200 vaccines allotment by the 1st of next week, and should receive up to 400 more doses to continue vaccinating community health workers, including West Kentucky Community Technical College allied health students, which Dr. Stack has indicated that we need to vaccinate the students because they're working in our healthcare facilities. And they're also going to be assisting with vaccinations with additional clinics to be named, and also at the local health department. So, as you all know, we have surrounding counties and the counties throughout the whole state of Kentucky that have been allotted their first rounds of vaccine. And after they have vaccinated their first responders and their healthcare workers, many of them do not have the healthcare worker base that McCracken has. And so they have been using up their additional vaccine in advertising for the 70 plus population and also school personnel population. And I will say I've had direct conversations with Dr. Stack, several conversations with him about this situation. And I have reached out to him and asked for additional vaccine to help catch up McCracken County with some of our other surrounding counties who've already moved away from their 1A phase. So when these surrounding counties end up using their additional doses from their first allocation, they're going to be limited on what vaccine they can order and receive in their counties, because Dr. Stack is wanting to bring everyone up to the same level and make sure that everybody is vaccinated in the phase 1A before we move into the phase 1B. So I just want everybody to understand that, these other counties that received vaccine, that had additional vaccine, they're only going to be using the remainder of that, for those populations. And then after that, supposedly, they're going to be limited on what vaccine they can receive until all the other counties that have not vaccinated all the 1A population vaccinates all the 1A population. So that's what I wanted to bring to everyone's attention, is where we were in our rollout of the vaccination plan. And I can assure you that we're doing the best that we can, and I'm trying to get as much vaccine into the county as I can, and to line up our healthcare workers to get vaccinated. I've worked with our West Kentucky Community College on the nursing program Sherry Golson, and we've had conversations today, and we have those students that have gone through the training. We have to get them registered through KYIR, and they'll be able to assist in providing vaccination clinics at different locations that will be named. Also help and assist at the local health department. I'd be glad to answer any questions.
Hey, Ken, I didn't follow what that was about the 5 versus 6 vaccines from a vial, or what were you saying about that?
Okay, so with the Pfizer vaccine, it comes in a box, and it's got 975 doses, and they're in 5 doses per vial, and they're able to get an additional dose out of each vial. So it does create some additional doses for each box of Pfizer vaccine that is received.
Kent, could you talk a little bit about, when we talked a couple of days ago, you talked about vaccine hesitancy and folks, trying to decide whether or not they wanted to get the vaccine, and then registering, and then changing their mind, and sort of the havoc that creates?
Yeah, I mean, our process that we were given from the state was to survey all of the non-hospital healthcare worker entities, different doctors' offices, dental offices, chiropractor offices, physical therapy offices, and give them the survey. And so they are to survey each of their employees to find out whether or not they are willing to receive the vaccine. If they are, then they go on the list, and there's some additional information that goes on that list, and then they submit that list to us. So that, for the health department, has kind of slowed us down a little bit, just trying to coordinate doing all the surveying and getting the names on the list, and then setting up a system to be able to, contact these individuals to schedule them. And I'm very proud of our hospitals and what all they have done, and I can't speak highly enough of them. And they've gone above and beyond to help out the state, help us out locally to get more people vaccinated. They are not under the same direction we were as far as like getting the surveys done and whatever. So whenever Baptist put out on their website that, hey, email us, we'll call you, get you scheduled. And our system was a little bit more delayed and complicated than that. As of last night, we've actually put on our website a similar contact method so that people can email the health department, and then we will contact those individuals back and get them scheduled. So we're trying to accelerate that as quickly as possible. And I know it's been really slow, to start out. There's been a lot of bumps in the road, but I can assure you that we're doing everything possible to accelerate this and get as much vaccine in and get it in the arms of individuals that want it.
And just one more question, Ken. I know people out there are, naturally people are wanting to know when can I expect the vaccine? But I think what's also very important is to talk about the process. Once you start working down these different groups, if you could just describe the process that will unfold for people to be able to get the vaccine.
Okay, so once we get through the 1A population, we will have already started the registration process, for the 1B population, so that we can already have, some people, ready to be vaccinated. Obviously, the health department cannot vaccinate all of these individuals. We have a small staff, and we rely upon our community partners, to step up to the plate and provide vaccination clinics. we're researching, different things that we should possibly do and look toward doing. And again, it all depends upon the amount of vaccine that we receive. Obviously I can imagine, having, mass vaccination clinics whenever it comes to where more of the population is eligible to receive the vaccine, so that we can, maybe have places that could do, 500 a day. But we would have to have a larger facility, and obviously it would be better if it was indoors. We do drive-by testing right now, and we could do drive-by vaccinations. The problem with that is that after you have received your vaccination, we have to monitor you for 15 minutes. So you'd have to have a parking lot big enough for people to pull into to sit for 15 minutes and for us to check up with them. So we've got some things out there that we're talking about. And again, I'm in very close communication with Dr. Hausman and Dr. Franke, and certainly open to ideas from other individuals, and anyone who's willing to step up to the plate and say, hey, we think this would be a great place to do it. And when more vaccine becomes available, then, we're going to make it available to you. I know, the Heartland Worship Center, stepped up to the plate at one time when we were doing testing out there. So, that's always a possibility. We had drive-through testing at the college. Of course, that was when the college was not in session. They're in session now. It would be more complicated at that time. So we're very open, to ideas, and willing to look at everything and come up with the best decision on how to roll this out when more of the population is eligible. And of course, the other thing too is that we've really encouraged, all of our providers to register in KYIR. And you have to be registered in KYIR in order to be able to order and administer vaccine. So we've got a huge list of medical providers in Western Kentucky that can provide the vaccine. It's just whenever the door will be, the question is, when will the door be open for them to be able to order vaccine and then advertise, just like you do with the flu clinics, for them to come and have their vaccines there.
Kent, is there, there's some people who are reluctant or even refusing to be vaccinated. Can you address that? Is there some science that would apply here to assure people they should be, or is there any concerns? And what's your feeling on that?
Well, I think the process that our research companies have gone through, have followed all the CDC guidelines, and there's some great assurance there that they are safe. I personally, feel like that they're safe. And, we've had a few adverse reactions that we've seen on the news, but nothing that I think raises a lot of concern. I think with any vaccination, you're always subject to someone having some sort of allergic reaction. So obviously with this being new, and anybody who has an allergic reaction, it's going to get a lot of attention. So I just want to try to assure everybody that, it is safe per the CDC, and we would really like to see more people choose to be vaccinated. I know that the vaccination percentages of people who are electing to have it, range somewhere around the 50% level. I would assume that it would probably be higher, in a healthcare setting, since it's those individuals who are having to deal, with COVID-19 on a daily basis, and see what people are having to experience that have this virus.
I would want to say that, although I don't know the medical side of this particular virus and the things you're talking about, as a general legal theory, having been being a retired judge for some 20 plus years. I'm just real confident that a company, no company is going to put out a product, particularly one that's being as publicized and widespread across the world, without having a great deal of confidence that they're not putting out something that's going to cause them harm and make them liable under products liability law or whatever. And so that's where I look at it. I just think that to believe otherwise would be ignoring the fact that these companies are going. I mean, it was a quick process, record breaking, as we saw the whatever they call it, warp speed project. But these companies are not going to put out a product that is going to injure people and face that risk of liability. In my opinion, my experience.
In a conversation we just had with Dr. Stack a few minutes ago, he indicated that, right now we're on track to receive the state of Kentucky about 53,000 doses of vaccine a week. And if we stay on that track, he made a prediction that about 65% of our population in Kentucky could be vaccinated by the end of June.
Okay, so are there any other questions? Any of the news media have any questions?
Yes, I do. So let's see, have a few here, but for...
Can you identify yourself?
Yes, oh, I'm sorry. Me, Temi Adelea with WPSD Local 6, and I have a few questions for Mr. Koster. First things first, how many vaccinations have you received at the department, and how many has the department administered so far?
Okay, as I mentioned before, we had allocated 200, and by the first of the week we will have used all of them, and we'll have 400 more to begin vaccinating next week.
Okay, and so do you have some sort of program that you're using to help your patients track their symptoms?
To track their symptoms?
I know that Baptist Health was doing something along the lines using a Be Safe program, and I didn't know if that was something that you were using as well.
I know that they're, you're talking about for symptoms if they have the virus, is what you're saying. Correct. I thought you meant like any kind of symptoms that or something that they might have as a result of getting the vaccine. We have in our health department, for our employees, we do, and then with our contact tracers that we have a system in place where if someone has tested positive or if they've been identified as a contact, there is information that's been given to them, and there's forms that they keep log on a daily basis to track their symptoms. And of course, if they have symptoms, then they're encouraged to contact their primary care physician to follow what their advice would be.
And so in the event that someone did show symptoms after getting the shot, is that something where they'd have to call and report that to you, or how would they go about doing that if that was the case?
Yeah, that wouldn't change. If they have COVID-19 symptoms after they receive the vaccination, they would still need to be tested because I know of a family member who received the COVID-19 vaccination, and a few days later they were tested and had COVID-19 because they were exposed. Okay, not to the vaccine, because they were exposed. So the incubation period or the period of time to build up enough antibodies to resist the virus hadn't kicked in yet. And I think it's like a 2-week period that, that begins to work. So.
Okay. All right. Those are all my questions for right now.
Kent, maybe it'd be informative if let's say I get a vaccine today. Does my need to mask, wash hands, distance decrease with that first dose? If I get then in 3 weeks the second dose, does it decrease, or should I still be doing exactly the same before vaccination, either the first or second, as I was before?
You should be doing exactly the same thing you've always been doing, and I encourage everyone to realize that just because they received the vaccine, there is no data, scientific data, that shows that it slows down the transmission, or that you cannot transmit COVID-19 just because you had the vaccine. And there's a question here from WKMS. She doesn't have a microphone. Rachel Collins. It says, I don't have a microphone on my computer, so I have to ask this way. Have you received reports of any adverse reactions to the vaccines on a local level? No. Just wondering how common that is. Thank you. I have not received any report of any adverse reaction for any vaccine that has been administered so far locally.
And I understood before we started this that our operator, our technician, said that people could, if they wish, to unmute themselves and ask a question. So I'm not sure how you do.
Correct, Judge.
So the folks should be able to see that are monitoring this how to unmute themselves and ask a question if they wish.
You just have to click down in the lower left-hand column on the unmute to unmute yourself to ask a question.
So it sounds like maybe we've answered every possible question.
I'm sure people have ongoing questions. Judge, I think it's safe to say that we're committed to doing this again at the appropriate time to provide more information. We'll partner with Kent and the Purchase Area Health Department to make sure that our folks get as much information as possible when they need it.
I think there's one other question that wasn't answered that I expected to be asked, and it's kind of like, when do we plan on moving from 1A to 1B? I mean, that's a good question, and I don't have a good answer, but I'm very hopeful that it will be, in like a 3 to 4 week maximum period of time before we move into the 1B. Hopefully sooner than that. It all depends on how much vaccine we get.
Well, and then also, of course, if people should come up with a question later, they can call my office. I'm sure the mayor would be willing to take the call, and Kent would think he would. Where they post in the newspaper, or it's, I think, online, our email addresses. If I had to take any email addresses or email questions, and we can compile those things. And I do think, the mayor, it's a good idea to, since we do have such a moving target, and this thing is progressing so quickly, and we're going to see other rumors come up that need to be addressed, and that sort of thing. So I don't know that we need to, I leave it up to you. I think we want to set a date and time now, or I would think we can come up with that here very shortly, maybe a week later or something like that you have a different idea.
No, I think we can get guidance from Kent, we can stay in touch with Kent and know when vaccines are coming in, how things are going to get ramped up. Maybe when he goes from 1A to 1B, that might be a good time to think about doing that. People are obviously very interested in that. That's a big part of the at-risk population, and so I think we can set that time in the future, Judge.
Okay. Oh, and hey, I meant to ask earlier, and so this thing about, I don't know your state of your knowledge, Kent, on this new strain that's coming from United Kingdom and supposed to be quite a concern. Can you give us any kind of guidance on that before we shut down?
Well, the thing about that is that what they're saying is it's a lot more contagious. It's transmitted much quicker and faster than this original strain of COVID-19, which raises a lot of concerns, and we're seeing it pop up, across the country little by little. And it's just like COVID-19. It'll hit here just like it hit New York and Los Angeles and Denver at some point in time, and we just need to be ready for it. And hopefully, we'll have many of our folks vaccinated by that time, and hopefully the vaccine, will work just as well, with that mutated form of COVID-19 than that it does with the current one.
So, not any questions? Are we all done?
I think we are, Judge. I just want to thank everybody for joining. And I think it's been I just want to echo, Judge, maybe what you said earlier on, and that is there's a lot of people working to be successful here, and it is a very challenging situation. I'm getting messages from people in the community, text, emails, people asking questions. So the goal of today was to get more information out, but we're all working together to try to get vaccines administered as quickly as possible. And as you said, Judge, we appreciate everybody's patience in doing that.
All right. Well, thank you, Kent. And we'll be talking among ourselves, and we feel like it'd be appropriate and necessary for ever to meet again. We can do that. So put some more information out. Anybody in the meantime, send those questions to us, and we'll gather the information best we can and get that out. Either right back individually or in one of these broadcasts. All right, then.
All right. Thank you.
All right. Thank you.
Thank you, Kent.
Thank you, guys. Appreciate it.